Hey, what's going on, guys? It's Dr. Nessum. I am an intern in New York going into PM&R and hopefully sports medicine. Today, we're going to be reacting to the TikTok king of the medical comedy world, Dr. Glaucomflecken. I've seen a ton of his videos. He's really blown up over the last couple of years, and I'm going to watch a couple of his videos and give my honest reaction to them.
Good morning, students. Today, you will be performing a neurologic exam on a standardized patient. You will be graded on your performance. You have 20 minutes. Good luck. Hi, I'm student. Good morning.
Standardized exams, just for those that don't know, is basically actors who play the role of patients. These were always in med school something that you got a little bit of anxiety going to do because you just never knew how the actors were going to be, what the cases were going to be like, and sometimes it was definitely hit or miss.
You're my standardized patient? Oh, trust me, nothing about this will be standard. Oh, come on. I will be grading your neurologic examination on a scale from seasoned neurologist down to emergency medicine physician.
Ooh, that's a shot at.
You may begin. I'd recommend you get started before your neurofibrillary tangles kick in. Okay. Can you close your eyes and identify this smell? Fear. Oh, you're gonna hand me something. Okay. My peripheral vision is perfect. I can see a hospitalist before they even think about curbsiding me. Do you intend to check temperature sensation, or do we live in a world with...
Curbsiding basically means instead of placing a formal consult, if you just see someone that you need to speak to, you basically speak to them in passing, but it's not placing the computer as a consult.
The spinothalamic tract doesn't exist. My cerebellum is magnificent. Purkinje cells the size of a house cat. I will eat my phi beta capita if you're able to see my optic nerves with that thing. You know, we can skip pain sensation. This entire experience will suffice. You'd better pick it up. So far, I'd put your exam at the level of an academic orthopedic surgeon. Well, the last thing are your reflexes. What are you doing? I'm just gonna check your reflexes. With a stethoscope. Yeah. You know how they say your life flashes before your eyes right before you die? Yeah. Well, what are you seeing right now?
Yeah, so if you're in a standardized exam, you definitely do not want to check reflexes with a stethoscope, but it is something that you'll see people do in the hospital all the time. I even have been, you can get reflexes if you get really good and just flick your fingers. You can actually get like a brachioradialis reflex or the patella reflex.
Hey, boss, I got a... Are you okay? Yes, Christopher. Why do you ask? You're ripping out pages of a journal. Yeah, because it's worthless, Christopher. Okay, what's going on? The government has decided that we can't make people pay for research that was funded by the government. That's a bad thing? Yes, the entire academic publishing business model is making taxpayers pay for things they've already paid for. But that's so unnecessary that there's no reason for that business model to exist. Of course it's unnecessary. Look, you don't get on the cover of Middleman Monthly by being necessary. What are my fellow middlemen gonna say when they hear I've been cut out? I don't know. That's the #1 rule of being a middleman. You don't get cut out. I'm so sorry. I don't think you mean that. No, I don't. We've been gatekeeping academic research for far too long. Things need to change. Oh, don't be dramatic. We don't gatekeep research. Yes, we do. You even named the company softball team the Gatekeepers. Well, if we can't profit off of publicly funded research, how are us lowly publishers supposed to make ends meet, Christopher? We make billions of dollars every year. I think we'll be okay. Yeah, for now. Within 5 years, our profit margins could go as low as Google. You know, this is a good thing for society. It gives the public more access to the latest scientific advancements. Well, I hope the public enjoys their free randomized controlled trials. Because I am about to create open access fees that are so egregious. It'll make United Healthcare blush.
All right, so this one might have been a confusing one, but it's actually true. This goes on in the research world. So I've even now recently had to tried to submit to journals that want you to pay a pretty hefty fee for them to review and see if they'll accept you. But then they might not even accept you. So then you're not even paying to get published, which you shouldn't be doing to begin with. But I'm saying like you're paying without even knowing if you're getting published. So then you're just paying for a review to potentially get published. Then there's also journals that will let you pay to get published, which shouldn't be the case. And you basically pay to get your research in that journal. Those are usually going to be much lower tier. Then, for example, I was trying to go on Google Scholar today and get an article I wanted to quote in one of the videos that I'm making, but I had to pay for that because I wasn't connected to my university's library, which lets me get access. But if I didn't have that, I'd have to pay. And then there's some publications where you can send your article for review, and if it gets accepted, you have to pay. So it's one big system of pay to play, which is not how it should be within academic publishing.
Hey, boss, you got a second? Oh, hey, Jimothy. Yeah, what's up? Well, a lot of our customers are pretty upset about the cost of their prescription medications. Yeah, I bet. They're super high. Is there anything we can do to help bring that cost down? Oh, you're going to have to talk to the pharmacy benefit manager about that. What is that? The pharmacy benefit manager. The PBM. Jimothy, did you not study your health insurance chain of command? The PBM negotiates discounts with the pharmaceutical companies. Oh, and then they pass those savings down to patients? Oh, God, no. Ugh. No, they pocket the money, reap enormous profits, which actually increases the cost of medications to patients. Really? Yeah. PBMs run every aspect of the drug market. They set prices and they determine which medications will be covered by your insurance, all to the highest bidder. Oh, God. Well, do you know where I can find one of these pharmacy benefit What's happening right now? Hi, I'm the pharmacy benefit manager. I'm confused. Jimothy, it's actually me, United Healthcare. Yeah, I know. You're also the pharmacy benefit manager? Yeah. Well, we go by Optum, but, it's all United Healthcare. Anything else you own? Oh, we have our own pharmacy, Optum RX. Yeah, all our customers have to use it. It's great. So let me get this straight. The PBM, that's me, decides which medications are covered by health insurance, also me, and which pharmacy, me again, the patient uses to get those medications. Vertical integration. We make $200 billion a year. It's awesome. Surely there's some kind of oversight, right? Somebody has to keep you accountable. You don't make $200 billion a year with oversight. How is any of this legal? Jimothy, when you make enough money, you get to write the laws.
Yeah, this video is like wildly accurate and a sad state of why costs in healthcare are so high. Some people will say it's because doctor salaries are too high. That is definitely not the reason. It's because you have big health insurance corporations like United and others. I'm not saying there's not a role for insurance in certain circumstances, but when they're be able to set the prices of drugs as well as what drugs are even covered by the insurance, and then sometimes you'll need prior authorization for different procedures and certain medications, they basically have a monopoly on healthcare. And so the problem is there's these middlemen, which are the PBMs, and they're able to set prices. Now, fortunately, you're starting to see other companies combat this by going direct to consumer. So for example, Mark Cuban has Cost Plus Drugs, and if you go onto their website, you could see all the different medicines that they now offer. And it is insane how much less it costs to get those medicines straight through their website. And so it won't be covered by your insurance, but that's okay because you'll probably get it for less than you would get it even if you use your insurance, which is absolutely insane. We actually had a case where we needed to prescribe Cinacalcet to one of our outpatient, and I think they were prescribed it before, they never ended up picking it up, and our attending was like, yeah, we're probably not gonna end up writing the prescription. They're not gonna be able to go and get it and afford it. It's like $800. And I said, you know what, let's look up Cost Plus Drugs and see what it cost. I think it was like $18 that it cost or something around there. and we were able to get that patient that medication. So some of these businesses, like congrats to Mark Cuban, I actually tweeted about this, he retweeted it, that was very exciting, and they don't do any marketing. Mark Cuban is the marketing, and so word of mouth and things like this are spreading and are starting to combat the monopoly that some of these health insurance companies have. So that's a quick rundown of the very complicated medical system we have here in the US, and I'll maybe make a video in totality discussing it. But yeah, this was a really good comedic but also sad TikTok video that explains that.